warm welcome to this special interview. My name is Anoop Verma. I am the editor of ETGovernment, which is a vertical of the Economic Times focused on covering government initiatives and policies. Today, our guest for this special interview is Dr. Rajendra Kumar. He is the Director General of Employees State Insurance Corporation, ESIC. ESIC is a very important social security body under the ownership of Union Ministry of Labour and Employment. So I come to Dr. Kumar. I'll complete.
Yeah, thank you.
ESIC is one of the oldest government bodies in the country. The passage of the ESIC Act 1948 was done in 1948 and was the first major legislation on social security for workers in independent India. So how has the journey of more than 75 years been for ESIC? Can you give us an overview of what its organization has achieved?
Yes, so ESIC, as you mentioned, it was created in 1948 through a legislation. And since then, it has really expanded to cover the entire country. And it provides very important social security schemes for the workers in the organized sector.
Okay.
And after over 75 years of its existence, today we cover the entire country. All the states and UTs are covered under the ESIS scheme.
Okay.
And our endeavor has been to ensure that we provide the coverage under this scheme to all the eligible workers in the organized sector. So it has done really well. It has provided a very meaningful social security coverage to the eligible workers in the organized sector. And our goal is to expand to the remaining districts where the scheme is not notified as of now, and to ensure that the workers in all parts of the country can be covered.
Okay. And there's some move to ensure that this organization also covers the unorganized sector also. Is there some policy going on? That kind of thing?
Yeah, as of now, as per the Act's mandate, we cover workers only in the organized sector. So as and when a mandate is given to ESIC to also cover the workers in the unorganized sector, then definitely we would formulate schemes accordingly and provide coverage to them as well.
So how is ESIC using digital and emerging technologies to provide social security to workers in efficient and transparent manner?
Yes, so this is one of the areas where we have made constant endeavors in the past to provide a seamless digital interface to all our insured persons and to the employers, because we believe that technology can enhance the user experience and also provide services in a seamless manner through an online mechanism to both the employers and the employees. So we currently have a platform called Dhanvantri, which provides comprehensive services to both employers and employees. And through this interface, in the last several years, we have provided a very seamless experience to our stakeholders. This platform recently we have enhanced to provide more online services. For example, today we provide all our cash benefits through the online application to our employees, that is insured persons. We have an employers portal where employers can do all the activities, including registration of new employees, etc., through the online platform only. All our contributions that the employers and employees they need to pay. Employers, they deposit the contributions only through the online platform. So the entire platform now provides a very seamless experience through an online application to all our employers and employees.
Okay. How many districts are you covering as of now? And how many of these are fully covered and how many are partially covered?
Yes, so at present, we are present in all the 36 states and union territories. And in terms of the number of districts where we have notified the scheme, that number as of now is 661 out of 778 districts. Out of 661 districts, the scheme is fully notified in 556 districts. And in 105 districts, the scheme is partially notified. That means it is notified in the at the district headquarters, where we have industrial establishments and where our insured persons are residing. So that is the current status. But our endeavor has always been to expand the coverage, and provide the benefits to all the eligible workers in the organized sector.
There's some scheme called MIMP. How does this scheme serve the needs of the workers?
Yes, so MIMP stands for Modified Insurance Medical Practitioners Scheme. So this scheme is meant for providing medical benefits to our insured persons in the areas where we don't have any direct physical presence. So in areas where the dispensaries may not be there because the area has been notified recently, etc. So in such cases, we enroll private medical practitioners to provide the medical benefits to the insured persons. And this is done through a transparent process where we allow the private medical practitioners to get enrolled in our MIMP scheme. And then they are allowed to provide medical benefits to the insured persons, which means they would provide the medical consultation, they would provide the medicines, and they would also provide the diagnostic facilities in the form of primary medical care to our insured persons.
I think ESI is also running its own hospitals in many parts of the country, and some of them are being operated by state governments for the benefit of the workers.
Yeah, that's right. So totally at present, we have 161 hospitals, out of which 55 we run directly from ESIC, and the remaining 106 are being run by the state governments. So these hospitals are providing medical benefits to our insured persons and their dependents. At present, we provide insurance medical benefits to 3.42 crore insured persons. And when we also include the dependents, then the total number is about 13.4 crores. So these beneficiaries are part of the ESIC network. And through these hospitals, we provide the primary care, secondary care, tertiary care to all the beneficiaries. So the hospitals are run by us. They are staffed by our own people, which means we recruit those manpower, doctors, then specialists, then nursing and paramedical personnel. The hospitals which are being run by the state governments, for them, the responsibility lies with the concerned state governments to provide all the services. So they would recruit the doctors and they would recruit other staff, and the hospitals would be administered by them. For operating the state-run hospitals, we provide the budget support to the state governments for running those hospitals and dispensaries.
Okay, and you are also providing treatments in Ayush also, not just the Western medicine. Ayush medicines also are being provided. Right?
Yes, yes. So Ayush is a vital part of our ESIC is a bouquet of services where we aim at providing holistic care to all our beneficiaries. So the vision is to ensure that we provide the treatment from multiple streams or multiple disciplines, so that the beneficiaries can have option or choice to choose the system of treatment that they desire. And even our doctors, they advise them on the correct course of treatment, taking benefits from multiple streams of treatment available, multiple options available. So at present, we have more than 400 Ayush units working in different hospitals that ESIC and ESIS, that is state governments, they run. And they have all the facilities for providing treatment under multiple streams under Ayush, for example, Ayurveda, then homeopathy, Unani, Siddha, etc. So our goal is to provide holistic treatment to all our beneficiaries.
In December, you had held this Suvidha Sangam to resolve the grievances of the pensioners and employees. So, so what was the experience like in holding this kind of conference?
Yes, yes. So, Suvidha Samagam is a regular event that is conducted by ESIC all across the country on the second Wednesday of every month, on 27th of every month, where the goal is to resolve the grievances of the employers and employees. And at the headquarter level, we have held online Suvidha Samagams, which are conducted simultaneously across all our offices, including all the regional offices, sub-regional offices, and our hospitals, where we listen to the grievances of our stakeholders, including employers and employees, where the objective is to ensure that we provide them with a platform so that they can reach out to the higher level authorities in ESIC and so that they can get their grievances redressed. So this was an online grievance event held under my chairmanship, where we provided an opportunity to all the employers and employees to present their grievances. And we had directed all our offices to address those grievances in a speedy manner. And through this online mechanism, we were able to provide a seamless experience to all our stakeholders to present their grievances without having to come in person to the offices of the corporation. So it was a very novel experiment, which was done very successfully by ESIC to conduct this grievance event online across the entire country.
So how are the online systems of grievance redressal working in ESIC?
Yes, so we
What are the
also
key features? Are you also using some AI or other technologies to, I mean, some through chat and other means to guide the people who have grievances?
Yeah, so for the grievances, we already have an online mechanism through CP Grams portal and through our own portal where they can send the grievances online to our corporation offices. And our corporation offices, they have been given a framework, a defined timeline to address those grievances. So that system is working quite successfully. And since we monitor the grievances and their disposal regularly, so we are seeing a very good response from our offices to really address the grievances of the stakeholders, employers, employees, and other beneficiaries. That is one part. Secondly, in terms of using the latest technologies, we have launched an AI-enabled chatbot, which is there on our portal at present in a trial version, where the all the visitors to the website can see that chatbot and they can get responses to their queries. We are enhancing this chatbot to the next level of sophistication, where it will be based on a generative AI platform, where our goal is to provide very meaningful and specific responses to the queries of the visitors to our website, so that they can easily navigate through the multiple source of information about ESIC and its activities, its regional offices, their locations, the benefits, the services that we provide. So our goal is to use technology to the fullest extent possible to enhance the user experience who visit our website or those who come to ESIC for obtaining any service or for any kind of grievances that they might have.
Okay. Coming back to the topic of Ayush, I think you held a National Ayurveda Day at the ESI headquarters in November. So, what was the main focus of that National Ayurveda Day?
Yeah, so National Ayurveda Day is celebrated every year, and in ESIC we celebrate this day in a very effective fashion by organizing events across our institutions at the hospitals and the dispensaries, where the objective is to create awareness about the Ayush systems of treatment with a specific focus on Ayurveda. And we provide the experience that our doctors have gained over the years in treating patients through Ayurveda stream. And the IPs can get information about the specific issues which they can really seek treatment in the Ayush stream. So this is the objective. We also try to improve our focus on improving our facilities in the hospitals for the Ayush system of treatment. So these are the major objectives of the National Ayurveda Day. We provide eminent dignitaries in the domain of Ayurveda to grace the occasion at headquarters and in our field institutions, where again the focus is that the insured persons can get information about the Ayurveda system of treatment, and they can take benefit from the services that ESIC provides for Ayurvedic treatment.
You served as Additional Secretary in METI, where you spearheaded a lot of e-governance related initiatives. So at ESIC, what are the new e-governance related initiatives you have brought or you would like to bring in future?
Yeah, so we already have done quite a lot of work in improving our IT platform. As I mentioned, Dhanvantri is our main IT platform, which is there for past many years. This has been totally revamped now. We have augmented our server infrastructure to a great extent. So the systems, the applications are now available 24/7 to all the stakeholders, all our institutions. They are online now. All our hospitals, all dispensaries, they are all fully online, and all the activities, including the registration, the prescription, the pharmacy, all the medical records, they're all available online. So this is one part of the efforts that we have taken very recently to improve the overall performance of the IT platform and augment it with new features. We are also now interacting live in terms of providing messages to the patients who come to the hospitals for seeking treatment. So, for example, when they are issued a prescription, they get a message on their mobile phone that this has been done, and then they can see the prescription online on their mobile app directly, and they can also provide feedback. So we are obtaining feedback in real time now from all our stakeholders whenever they come for obtaining any service. So this has helped us in improving our services further and in refining the platform and the applications to serve our patients better. This is one part. Second, we have launched our app called AAA, Ask an Appointment Plus. So earlier, this app was only for seeking appointments, but now we have enhanced it to a full-fledged mobile app which provides access to all services that ESIC offers to all our insured persons. For example, they can seek online appointment. They can place a request for home sample collection. This also we have started recently through an online mechanism. They can see their medical records that earlier have been created when they sought treatment in the past. Since now we are also doing Aadhaar seeding and we are now on the Ayushman Bharat Digital Mission platform. So the records are now interoperable. So they can see the medical records that they have, and they can take it to other hospitals when they need to go there for treatment. So this entire system has been made interoperable following the National Digital Health Mission platform. So this is a major effort that we have taken, and the mobile app is now completely revamped. All these services are now available on the mobile app for our insured persons. Even the cash benefits that we provide, for example, we provide maternity benefit, we provide sickness benefit, we provide dependence benefit, we provide disablement benefit. So all the benefits, all the cash benefits that we have, those are also now available online. So people need not come to the corporation's offices in person to apply for cash benefits, which was the case earlier. So this is a major change that we have brought, and this has improved access to our insured persons in obtaining the cash benefits. And we are seeing the result in terms of the number of applications that we get for these benefits. And also the disposal of the applications has become much faster now because we have an online system of workflow where the requests have to be disposed in an online workflow mechanism. We also have created more than 20 real-time live dashboards where we get real-time data about all the services being delivered by ESIC institutions to the insured persons. So these changes have really revamped the entire system through a very significant enhancement of the IT platform and through a new mobile interface, which has improved the services very, very significantly. In future, we hope to enhance it further by adding more services and bringing all the services onto a mobile interface so that it is easily accessible to our insured persons and the other beneficiaries.
One last question, sir. The government of India has a vision of further growing the economy to make India the third largest economy. But if that we go in that direction, more and more people will come in the organized sector. That will put more pressure on ESIC. A lot of more people, employees will be joining. And also the new generation, they keep changing jobs. So all these, how does ESIC use new technologies to manage all new, so many new employees, and the fact that they are changing jobs, changing locations all the time?
Yes, so if you really see the growth of ESIC in the last couple of years, we have seen significant growth in the number of insured persons. That is the employees who are coming to ESIC as a part of the process that employers have to do for registration. So that number has grown significantly. And that shows that our economy also has been growing very robustly in the last several years. And we are seeing a significant expansion in terms of the number of people who are now part of the ESIC ecosystem, that is the insured persons and their beneficiaries. So in future, we really see this trend continuing because the numbers will increase, as you mentioned, because of our rapidly growing economy, and we are fully geared up to meet this challenge. We have approved 107 new hospitals in the last couple of years, where we hope to really expand our presence in terms of building new health facilities to improve the services to our insured persons and to cover new areas where requirement is there, but we need to enhance our presence. So this is going to really get expanded in the coming years. We have added our current total bed sanctioned bed capacity in our hospitals is about 27,000. With the addition of the 107 new hospitals in the next 4 to 5 years, our total bed capacity is going to increase to nearly 39,000. And the total number of hospitals that we will have after these new 107 new hospitals are built, total number will go to nearly 270. So that's a very large number. We already are country's largest health services provider, one under one single institution. And in the coming years, we see a very major expansion of our presence all across the country. So we really hope to support the growth of the economy, and we would really welcome new employees who get covered under our ESIC scheme.
Okay, sir. Thank you. Thank you for talking to us.